एवरीवन, वेलकम बैक टू माय यूट्यूब चैनल। आज की वीडियो में हम एक्सेस वेट इज़ अ रिस्क फॉर द लिम्फेडिमा ये चेक करेंगे एंड द रोल ऑफ द लिम्फेटिक सिस्टम इन द कार्डियोवास्कुलर सिस्टम इन द कार्डियोवास्कुलर डिजीज़। इन दो अहम टॉपिक्स को डिस्कस करेंगे। शुरू करते हैं वीडियो। Excess weight is risk for the lymphedema. Another extremely important consideration for the therapist to keep in mind the connection between the excess weight and lymphedema. Not only is obesity is being overweight a risk factor for type 2 diabetes mellitus, coronary heart disease, stroke, cancer, OA, but excessive weight is also a consistent risk factor for developing the lymphedema in the number of the studies. In a study of the stage 1 and 2 breast cancer suggest who received the radiation and then later developed arm edema, lymphedema body mass index BMI was found to be strongly associated with frequency of the arm edema. Of all of the variables looked for, the BMI was also related to increase the frequency of severe form of the arm edema. To illustrate this finding, only 2.3% of the non-obese subjects as compared to 9.2% of the obese subjects developed the severe arm edema. Another study looked at the surgical complication associated with the sentinel lymph nodes biopsy in the women with early stage breast cancer. The investigation used multivariate logistic analysis with 2,904 subjects and found 7% overall incidence of the lymphedema. Although increasing age group by decade was found to have a positive and significant association with the incidence of the lymphedema, BMI was found to have even a stronger positive association. Lymphedema incidence rate were 4.9% for the normal subjects, 6.5% for overweight subjects, 9.8% for the obese subject, and 21.7% for morbidity obese subjects. And association investigated the incidence of the lymphedema 20 years after the woman had been diagnosed with the breast carcinoma and consequently treated with the mastectomy and complete axillary dissection. They looked at 15 potential predictive factors for developing the lymphedema and found that the only two factors were statistically significant for predicting lymphedema: arm infection and weight gain since the operation. They also found that the women who were overweight when diagnosed with the breast carcinoma also had an increased risk of developing the lymphedema. Clearly, the literature supports that being overweight or obese is a risk factor for developing lymphedema is a breast cancer patient. Thus, the physical therapist should keep in mind that a healthy lifestyle and a normal weight can help to prevent the lymphedema in at-risk patient. The role of the lymphatic system in the cardiovascular system and in the cardiovascular disease. The myocardium is populated with a high number of the initial lymph vessels that lead to the lymph precollators and collections. Eventually, this lymph is the funneled through the cardiac lymph node and into the thoracic duct. As are true for fluid homeostasis in other body tissue, fluid homeostasis in the intramyocardium is also dependent on the balance of the fluid filtration and resorption involving the blood vessel as well as fluid flow into the myocardial lymph vessel. In one study using dogs, disruption of the cardiac lymph system is resulted in the electrophysiological change in the heart. These changes included the decreased impulse conduction and formation that resembled human sick sinus syndrome. It is important to note that the irregular contraction of the heart and the regular extracardiac thoracic movement play a role in the myocardium fluid movement. In that, myocardial lymphatic system is the primary pathway for removing excess myocardial interstitial fluid. When a patient heart excess myocardial fluid, when a patient heart is arrested during the surgery such as cardiomyo bypass during the coronary artery bypass graft CABG surgery, myocardial edema result. This is a properly functional myocardial lymphatic system promoted by the heart contraction is crucial during the post-operative recovery phase of CABG patient. The role of the lymphatic system is the pathogenesis of the cardiovascular disease is becoming the better understood. It is well known that the inflammation and the fibrosis occur when the lymphatic system is not working properly, but it is a less appreciated fact that these same processes may play a crucial role during the formation of the atherosclerosis in the vascular wall. यहाँ तक अगर टॉपिक में कोई इशू हुआ तो ज़रूर आप डिस्कस कर लीजिएगा। इजाज़त चाहूँगी। अल्लाह हाफ़िज़।